Now, in the U.S., it's quite fashionable these days to blame these gaps and disparities on a broken healthcare system, an incompletely insured population, lack of alignment between payment and care delivery, and a host of other factors. I'm sure you have your own challenges wherever you live. But we believe that the systematic application of sound improvement science can make a difference, even in systems that would benefit from a transformative overhaul. Now, I can't emphasize strongly enough that policy and payment reform alone cannot achieve the very high level of health care quality we need. And we always need to be mindful that dramatic changes in the healthcare system almost always have unanticipated consequences and can leave caregivers and patients struggling to deal with new, often confusing regulations, payment structures, and reporting requirements. Now, I also want to make it clear that while good quality improvement is really important, improvers and change agents always should celebrate and attempt to leverage advances in technology and therapeutics. When you get to be as old as I am, you're really going to appreciate the miracles of modern medicine. The virtual elimination of a growing list of vaccine-preventable infectious diseases, drugs that have turned AIDS into a chronic disease rather than a death sentence, oral drugs that can cure hepatitis C, a startling fall in hospitalizations and mortality for heart attacks and heart failure. So that's the paradox, a so-called broken system that nonetheless continues to produce medical miracles. Our work as improvers and change agents is to make sure that these miracles are available to all people who could benefit, regardless of wealth, education, race, ethnicity, gender, sexual preferences, or geographical location. At the same time, we need to make sure that patients who cannot benefit from these treatments don't receive them inappropriately, which merely incurs needless cost and may actually lead to side effects and harm. We also can do a much better job partnering with patients and families so that they participate in their care and can voice their own preferences and concerns. We can make our care systems more efficient so that we reduce waste, reduce burnout, and increase joy in work. We can make healthcare much safer and reduce the chances that patients will experience harm anywhere across the continuum of care. If we do this well, we will improve quality and reduce cost. In other words, we'll increase the value of healthcare. Now, I should add that the Institute of Medicine's report focused on health care, but the same principles of quality improvement can and should be applied to improving the health of the population and addressing the social determinants and so-called upstream factors that lead to poor health. Many of you will want to apply what you will learn to problems you see in your community, be it nutrition, obesity, smoking, screening, and prevention.